Before I move away from the skin, I want to talk a little bit about perioral lines. A lot of times people will come in and they say that gals tell me the lipstick kind of runs up and down, and sometimes women tell me even though they've deliberately tried all their life not to use straws, they get the lines, which is amazing to me. But how do we take care of perioral rejuvenation? We look at the lines, we look at the proportion of the upper lip and lower lip. Usually for dark-skinned Hispanics and Africans, it's the ratio of 1 to 2. For Caucasians, it's 1 to 2. For more pigmentation, it's really about 1 to 1. So we need to look at that, and we need to look at the volume. So again, no smoking, avoiding the sun, fats or fillers that I'll talk about. I'm very conservative with Botox in the perioral area. Dermabrasion can be very helpful, some ablative lasers or a deeper peel. I like to take the TCA sometimes with a sterile gauze or sponge and really scrub the deeper lines. So really what we're trying to do with the perioral lines is bring the shoulders of the wrinkles down. If you picture mountains in a valley, we can either fill up the valley with fillers or fats, or we can bring down the mountains closer to the valleys, or we can do a combination. So that's what we're trying to do. Okay, so that's a summary of how we are going to deal with aging texture of the skin. We've got some laser, we've got some TCA, we talked about some non-invasive treatments, facials and things like that. We talked about a little more invasive, we talked about the TCA peel. Okay, so what about Botox? Everybody wants to hear, does Botox actually work? Let me back up for a moment. And, oh yeah, so I'm going to show you some examples of the perioral. I'm very conservative with the Botox in the perioral area. It works, it certainly works. I love it for around the eyes. We need to be very careful around the lips because I don't like to change people's smiles. And sometimes for about 10 days, people will say, oh, you know, it felt kind of funny when I'm eating, saying my words. So we need to be very careful. But for example, here's a gal who was quite concerned about her lip lines, and there she is after some resurfacing and volume treatment. Here's a gal with some lines not as bad, but she got some volume and resurfacing. Okay, so that's an idea about the perioral rejuvenation. Okay, now what about the Botox? Botox, I showed you the little bottle a couple slides ago. It's a muscle relaxant. It started out as a medical surgical treatment for children with eye muscle imbalance, like cross-eyed, esotropia, or wall-eyed when the eyes go out. The ophthalmologist started using that. It can be used for any muscle spasm, for hyperhidrosis, which is excess sweating. It can work for certain migraines, especially sort of the headache, the tension, the muscular tension headaches. Now, what muscles are we affecting when we do Botox around the eyes? We know that there are depressors of the brows. The corrugators and the procerus and the orbicularis can bring the brows down. There's one major elevator called the frontalis muscle. So I've seen those muscles 1,000 times at least in the operating room. So if we selectively get the depressors to relax and let the elevators take over selectively, we can actually do a mini brow lift for someone, and we can get those lines between the eyebrows, the glabella, to relax. And I want to show you a slide. Most people, well, I know we have some music fans here. Most people have heard the accordion, and we love accordion players, right? Well, think of the skin overlying the muscles like an accordion. So the reason why the company calls these lines the 1s and the 11s and the 111s, it's the muscles underneath that are creating those lines. It's not the skin itself that has a wrinkle. Of course the skin has a wrinkle. But what happens is the muscles contract back and forth 100,000 times, and eventually, as the elastin and hyaluronic acids and collagen kind of wears out, you'll have a crease there. Picture if you take a piece of paper and you fold it back and forth 1,000 times, eventually you're going to have a crease there. Those are the glabellar lines and other fine wrinkles. So what do? How does Botox work as opposed to a filler? I want everybody tonight to know the difference between Botox and a filler. Because a Botox is a muscle relaxant. A filler is a volumizer, like Juvederm, Restylane, Belotero. It's volume. They're not interchangeable. Sometimes I use them both, and I'm going to try to teach you how and why we do that. So here's a gal who works with the public, and she said, she came in saying, you know, my coworkers and my clients think I'm in a bad mood, or they say, how come you didn't sleep well last night? And this gal is happy, she's in a good mood. We did Botox just to the glabella, and here she is, 2 weeks later, trying to give us that same expression. So it works. I don't want to bore you, but I can show you hundreds of these. Here's a gal, similar thing. And I think this gal had some kind of tension headaches, really helped. We selectively put the Botox into the muscles that are creating those furrows. Now, what about people who, I want to teach you a little bit about a static line and an active line. If you have smooth skin and you have lines only when you're dynamic or making an expression, Botox will likely, not erase, but make that line markedly improved. If even at rest you have a line, when you're not making an expression, we can use the Botox to soften the line, but then we may fill in some of that wrinkle or line or furrow with a little filler. So a filler is a volumizer, and I'm going to talk more about that when we talk volume. So sometimes people will come in, and I can tell because I do a little test. Is your line just static? Is it just dynamic, etc.? We'll say, okay, let's try Botox for a few weeks, and if you want more improvement, we can do the filler, etc. So they come in all kinds of varieties. Sometimes it's the forehead, sometimes it's just the glabella. It also works great for the lines on the sides of the eye. Some people call those crow's feet or smile lines. Now, I show this triangle because sometimes with very early platysmal banding, when that muscle under the chin starts to contract and people have little bands there, Botox put into those muscles will make them relax, and then they can fall back to a position where they belong. So here's a gal who had very early platysmal bands. You see those little cords underneath? A little bit of Botox on each side, and there she is about 2 weeks later. It's not a replacement for a neck lift, but if there's just early platysmal tightening and bands, then it can be very helpful. So, modern facial rejuvenation. I've talked about skin texture, I've talked about TCA peels, I mentioned laser, we talked about Botox. Now, what about volume? As someone posed a great question, how do we restore volume? Excuse me. There's two big categories. There's fillers and there's fat. I think most people have heard of fillers. Collagen, Juvederm, Restylane, Radius, Perlane, etc., etc. It seems like there's a new one on the market about every month. We categorize them based on what they're made of. Most of the time I use hyaluronic acids like Restylane, Juvederm, Belotero. There's something called a G value. The G value, the higher the G value, kind of the thicker the filler is. Voluma is supposed to last 1 or 2 years. I use that deep, like for the cheekbones. Something like Belotero has a very light, almost like an oil texture. It has a very low G value, so that can go under thin skin. So, what do fillers do? Fills lines, plump tissues, and I can do some non-surgical facial sculpting. Now, the other category is fat grafting. What's fat grafting? Fat grafting is what I do, a little bit of conservative liposuction. It doesn't take a lot, but I can do this right in the office when someone's awake. I just numb them up. It's a little bit of liposuction. Usually I do it manually with a syringe and like a big needle. We take out some fat, liposuction. Instead of throwing that fat away, we decant it or centrifuge it, sometimes surgically cleanse it, keep it sterile, keep it clean, and then we can re-inject that to another place. Cheekbones, temporal hollowing, even breasts, buttocks, the chin, nasolabial folds. It's sort of a natural, it's a natural tissue. It's a person's own tissue. Now sometimes people say to me, well, does it last? Is it real? About 67% of the volume we transpose to the face lasts. It's like Johnny Appleseed. If Johnny Appleseed goes around with 100 seeds, about 67 will take root, at least for fat grafting. 67% of the volume stays. So I overcorrect. So you look like you're pretty swollen for about 3 weeks. Then it starts to recede. If you ever gain weight, it'll get bigger. If you lose weight, it'll get smaller. Guess what? Just like if you never had fat grafting, right? If you gain weight, you're probably going to get a little micro amount of chunkier in the face. If you lose weight, you're going to lose fat. Now, keep in mind that with time, as we mature, we tend to lose fat in our face and in our hands, and gain weight in the trunk. And we can take advantage of the metabolism of those cells in the trunk that last as we mature, and sometimes even get bigger. And I do it for the back of the hand, cheekbones, nasolabial fold, etc. Now, it's true that we bring up some stem cells. You may have heard this expression, stem cell facelift, that I'm a member of the society, and we're not encouraged, we're discouraged from using that term. And that's because only 1 out of 176 cells that we transpose is a stem cell. We do bring up some estrogen receptors. It induces new blood supply. So a lot of my patients will say, you know, the fat grafting almost feels like I had a peel. But it just helps not only with the volume, but it helps with the texture of the skin oftentimes.
Is there less reaction as opposed to a filler?
Well, when you say reaction, I really want to know, like, is there allergy or?
An allergic reaction or bumps or redness or?
Okay, so after the fat transfer is much more involved because you have to have your tummy numbed up a little bit, and I harvest the fat, and then I numb up your face and transpose it there. The filler comes in a syringe with a needle, and it's sterile, and I can give you a block and inject it. So there's some bruising, little swelling, but I guess certainly less than fat grafting. But then again, it's temporary. So there's pros and cons. So, for example, here's a really good-looking gal who noticed as she matured, she was losing her high cheekbones. She's really good-looking. So in the office, I give her a dental block, and we put some reasonably heavy filler deep on the cheekbones to give her that effect. Now, here's a gal who was concerned about her lower lids. That's not enough for surgery yet. But remember I talked about the hill and the valley, the mountain and the valley? Well, how about if we fill in the valley to bring the valley up higher, closer to the hill? So that's what we sometimes do with filler for the lower lids, the eyelid cheek junction, for someone who doesn't have very profound changes. So she went from there to there. Now by the way, all these patients are mine, they're real cases, except for this next person who was in New Beauty magazine, and I was featured in there, and this is the so-called liquid facelift, only fillers and Botox. So only fillers and Botox, so it can be a significant change. Now, not a replacement for surgery, not a replacement for laser or a TCA peel. Remember the triangle, the pyramid? Volume, skin, soft tissue position and amount on top of the foundation, okay? So what I'm trying to convey to you is that if you come in for consultation, we need to design something for you. We need to go through step by step, your anatomy, what you want, downtime, do you want something in the office, do you need an anesthetic, etc. Everybody's different. So, now, here's a gal, remember I said they're different, right? They're both volumizers, but here's a gal who was concerned about what we call submalar wasting. A lot of women get this, some men get this too, but by the time I got out filler for her, by the time I got out so many syringes to fill up her cheeks, it would have been economically disadvantageous. So let's just take a little fat from her belly. We do a little conservative liposuction. It doesn't take tons. And there she is with her own fat to fill up the malar hollowing. So this slide is one of my favorite slides, the grape and the raisin principle. I think that some people, when they think about a facelift, they think of sort of the older traditional way when they would ask their plastic surgeon to pull so tight that you pull out all the wrinkles, and then you cut off the skin and you sew up real quickly before the skin springs back. What we're more advocates of are, what I'm more of an advocate of, is to lift and fill. So think of the grape in California, again, succulent, moist, soft, right, full of water, and you put it out in the sun for a while and it shrivels up and loses volume. Instead of pulling on the raisin skin and until all the wrinkles are gone, let's try to fill it back up, reposition the skin, take some skin off, etc. So I want to show you some examples. Here's another gal who has some loose skin, and if you look at her, think of that balloon that you let a little bit of air out. So if we do conservative, judicious repositioning of the soft tissue and take away some skin and do some filling, that's more of what I like to think about of the grape and raisin principle, right? Lift and fill. That's what we want. We want full, youthful, defined faces. Now again, let a little bit of air out of a balloon, lift and fill with a little bit of volume, conservative, instead of pulling really hard to give people flat faces. That's not what we want to do. Okay, so when we talk about surgery, most plastic surgeons, as I do, we look at the face in thirds. The upper third around the eyes and forehead, the mid third is the mid face, and the lower third is neck and jowls. Again, modern facial rejuvenation, here comes that slide again, skin texture, volume, soft tissue position and melt over the foundation. Now, I want to show some office-based surgeries, just very briefly. We do some